The takeaway message of this investigation is that social determinants are prevalent in patients that we manage with hypertension and really in anybody with chronic disease, and they have a direct impact on our ability to control blood pressure. My name is Richard Milani. I am the Vice Chairman of Cardiology at Ochsner Health. Our article is Racial Differences and Social Determinants of Health in Achieving Hypertension Control, and it will appear in an upcoming issue of Mayo Clinic Proceedings. So we know from past experience that hypertension control in African Americans tends to be poorer control than we see in whites. Moreover, there has been debate as to whether there is any genetic or racial differences that make one group of individuals less inherent to clinical interventions than others. The goal of this paper was to identify social determinants of health across both whites and blacks to determine whether or not it played a role in hypertension control, and then to discriminate if there's any differences between whites and blacks in the prevalence and the impact of these social determinants. Specifically, we looked at three that really stood out in our data. We examined blood pressure control in about 3,300 patients enrolled in a digital hypertension program. At baseline, we assessed a variety of social determinants, including three important ones in our data set, which include financial stress for paying for medications, patient activation, and health literacy. What we discovered was that, in fact, regardless of race, that the presence of any of these three social determinants, and we call them health barriers, blunted hypertension control. Moreover, if you had none of these barriers in place, at 1 year, patients with uncontrolled hypertension, 73% were under control. If you had any one of these health barriers, that control rate dropped to 60%. And if two or more of these barriers were present, the control rate dropped to 55%. So clearly, any of these three social determinants played an important role in blood pressure control, regardless of race. When we separated out blacks versus whites, we find that in our population, the prevalence of having any one of these health barriers was much more prevalent in blacks versus white. In fact, if we looked at two or more health barriers, it was dramatically more prevalent in blacks versus whites. Moreover, when we compared blood pressure control in blacks versus whites, we find that whites had a slight trend towards an advantage over blacks, regardless of whether or not they had a health barrier, until two health barriers were present. Once two health barriers were present, we saw no difference in blood pressure control between blacks and whites, suggesting that socioeconomic disparities are really the primary driver behind blood pressure control between both blacks and whites, and there is no inherent susceptibility based on race. What this means to clinical practice is that we typically do not capture this information in patients we're seeing in our clinic. We're not capturing health literacy or patient activation or even financial stress. And it's playing a big role in our ability to control blood pressure. In fact, just adding more medication to the patient is unlikely to be of benefit. We have to do a better job in health systems, and certainly society has to do a better job in as much as possible to both measure and address these health barriers. What this means for patients is that there is no inherent differences in your ability to achieve control, but you have really almost a glass ceiling in many cases preventing you from achieving control based on other factors that are impacting your life. And it's important for patients to understand that both society as well as health systems need to do as much as possible to try and alleviate as many of these barriers as possible. And finally, in terms of lines of research, we need to do what we can to address them and mitigate them and identify additional health barriers when present. I would invite both patients and clinicians to read this article and to help further our abilities to identify health barriers in all of our patients that we're managing for chronic disease. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.